Welcome to this video, where I'm going to discuss the dangers of bottle feeding and how it can lead to ear infections in babies. Stay tuned for more information on prevention and treatment methods. 1. What are the dangers of bottle feeding? When bottle feeding, it's important to be aware of the risks associated with not following proper hygiene. Milk residue left in bottles can harbor bacteria, and if the bottle is not cleaned properly, it can cause your baby to become infected. This can lead to ear infections and other health problems. 2. How can bottle feeding lead to ear infections in babies? Bottle feeding puts a baby in an unnatural position, causing the eustachian tubes to become congested. This increases the risk of bacteria or viruses entering the inner ear and causing infection. Additionally, when bottle feeding, a formula can sometimes get into the middle ear if the baby is not held in an upright position. This can also increase the risk of developing an ear infection. Finally, babies that use pacifiers while bottle feeding is more likely to develop ear infections due to increased fluid buildup in their ears. Therefore, it is important to pay attention to your baby's positioning while they are bottle feeding and discourage prolonged use of pacifiers during feedings. 3. Is there a way to prevent ear infections caused by bottle feeding? Thus, there are a few simple steps you can take to reduce your baby's risk of developing an ear infection due to bottle feeding. First, feed your baby in an upright position. This helps to keep milk from entering their ear canals, as it is more likely to come out the sides of their mouth instead. Second, tilt the bottle slightly so that the nipple is almost empty while they're drinking. This will help reduce pressure in and around their ears from swallowing too much air. Finally, burp your baby frequently during and after feedings to help release any built-up gas that could be causing pressure in and around their ears. With these tips in mind, you should feel confident knowing you are taking steps to help protect your baby from bottle feeding related ear infections. 4. Are there any treatments available for infants with ear infections due to bottle feeding? Thus, depending on the severity of the infection, your doctor may recommend antibiotics or other forms of treatment. They may also suggest changes to the way you feed your baby in order to reduce their risk of developing ear infections due to bottle feeding. This could include burping more frequently during feedings and avoiding laying them down soon after a feeding. It's important to talk with your pediatrician about the best approach for your baby. Additionally, if it appears that bottle feeding is causing too much air intake while feeding, they may suggest switching over to a slow-flow nipple or one specially designed to avoid this issue altogether. Taking preventative measures like these can help reduce the likelihood of future ear infections due to bottle feeding. 5. Does breastfeeding have any benefits that could help prevent ear infections in babies? Thus, breastfeeding can provide a number of benefits to babies that help protect them from ear infections. First, it helps to strengthen the baby's immune system by providing antibodies and beneficial bacteria which combat infection-causing germs. Secondly, breast milk is easier for the baby to digest than formula, reducing the amount of mucus in the throat and nasal passages that could lead to congestion, as well as containing enzymes that break down foods more easily and reduce irritation in the sensitive tissue around the eustachian tube. Breastfed babies also experience fewer episodes of spitting up or vomiting, both of which are associated with an increased risk of developing ear infections. 6. Are some types of bottles safer than others when it comes to preventing an infant from developing an ear infection? Yes, there are some bottle designs that can help reduce the risk of infant ear infections. Bottles with a venting system can help reduce your baby's intake of air, which may limit their exposure to bacteria and other germs that could lead to infection. Additionally, bottles made from materials such as silicone or gloss are less likely to contain BPA or phthalates, which can disrupt the body's natural defenses against illness. As always, it is important to regularly clean and sterilize any type of bottle you use for your baby regardless of the design. Moreover, remember that breast milk provides immune protection for newborns, and breastfeeding is the safest option for babies under 6 months old. If possible, try limiting or avoiding formula altogether if possible. With the right precautions and bottle design, you can help reduce your baby's chances of getting an ear infection. 7. Are there any other tips or advice you can offer parents regarding avoiding and managing infant ear infections caused by bottle feeding? Yes, parents should always ensure their bottles and components are clean and sterile, especially if multiple people will be handling the bottles throughout the day. Regularly cleaning the nipples can help reduce bacteria growth. Additionally, parents should take steps to limit air intake during bottle feeding. Letting babies feed in a more upright position, using a slower flow nipple, or making sure it isn't held too tightly against the baby's mouth can all help prevent air from entering the bottle. Lastly, be aware of any signs that an ear infection is brewing, and contact your doctor if you suspect there is already one present. Early detection is key when it comes to treating ear infections. We hope you have learned more about the dangers of bottle feeding and ear infections. Remember that prevention is key, so make sure to follow your doctor's advice when it comes to caring for your baby. If you found this video helpful, please comment below with any questions or thoughts you may have. And don't forget to subscribe for more health tips. Thanks for watching.